Hey, hello everyone, and welcome to yet another True Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the True Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the Truth Talk, I have Dr. Ranjani Rao. To give you a brief introduction about Dr. Ranjani Rao is a graduate from the prestigious RV Dental College and Hospital in Bangalore. Passing out in the year 2000, she has a rich clinical experience of 19 years in the field of dentistry. She has an MPhil in Hospital and Health Management from BITS Pilani, and a fellowship in orthodontics and surgery, and a mastership in implant dentistry. Dr. Rao is passionate about implant and aesthetic dentistry. Dr. Ranjani, along with Dr. Hema Ahuja, manages two state-of-the-art dental practices in Electronic City, Bangalore. Dr. Ranjani, thank you so much for joining me again for another True Talk with Your Dentist conversation.
Thank you so much, Dr. Rekha. It's always a pleasure to be back here.
Yeah. So I was just thinking maybe we just do some like a small role play here. I just thought I will pretend to be the patient and then ask you doubts and questions that I can possibly have as a patient about tooth fillings.
I'm picturing you to be Karan Johar right now. So we're doing a rapid fire.
Yeah, kind of. So can we start?
Yep.
Yeah. Okay. So if I were a patient, then I would ask, how long do dental fillings last?
A properly done dental filling should last for as long as the tooth is intact. It could go into several years, but an average life of a filling would be 8 to 10 years.
Okay.
It's better to revisit a filling after 10 years and see if it's fine or if it needs replacement.
Replacement. Okay. So will a dental filling hurt?
Most of the time, no. There could be a little bit of sensitivity because your dentine, the softer side of your tooth, is exposed when you're doing a cavity. So even when air passes, there's a small current kind of a feeling which we call as sensitivity, which is temporary. As soon as the first layer of filling is placed on the tooth, patient gets immediate relief. So I don't think you can classify it as pain, but yeah, discomfort for sure.
Yes, discomfort. Okay. So is the tooth filling expensive?
Anything that is of good quality costs money. If it came cheap, you can be rest assured there is a compromise in quality. Some of the best composite materials are very expensive. The best bonding agents that we have to use, the 7th generation, the 8th generation ones, extremely expensive. So a lot of doctors who are passionate about what they do would prefer to use the world's best. So for example, we use Japanese products, which we all know are probably the most premium in the world.
Yeah.
They come at a price. And I tell my patients, it's a small price to pay for the comfort and the peace of mind that you're getting for a long period of time. So we also take the onus. If the filling comes out within a short period of time, we will replace it free of cost. Most doctors would do that because we take a lot of pride in the work that we do.
Yes, yes. Okay. So can I have anything to eat after a tooth filling?
Yes, most modern fillings are composite. They are resin-based. They are adhesive stimulants, which means they chemically react with your tooth instantly. And they're set when ultraviolet light is exposed. So 9 out of 10 times, you're allowed to go into eating and drinking immediately after the filling is done. No restrictions.
Okay. Okay. So can I get a tooth filling done without an injection?
Absolutely. If they are just class 1, smaller cavities that require very minimal drilling, you do not need any anesthesia at all. Except if the cavity is very deep and the doctor requires to do extensive drilling to kind of clean up the decay, or if the patient is hypersensitive. Their threshold to pain is very low. There's a lot of apprehension. There's a little bit of fear. Then we give them an injection because then when the area is numb, the patient is more cooperative, more relaxed. So it makes the doctor's job easier. But if you're somebody who's more scared of injections than the filling, you don't require an injection.
Yeah. Okay. Can I go to work after a filling, after a tooth filling?
Absolutely. Most of my patients come, get their fillings done during their lunch break or their midday break, and they go back to work immediately after that. You don't need to rest or take a break at all.
Okay. Okay. Can a dentist mess up my filling?
Unintentionally sometimes, because these materials are filled by placing them layer over layer. Now, very rarely it can happen that a bubble of air gets trapped between these two layers. This could happen because of the lack of elasticity in the material. It could be because of a slightly erroneous technique on side of the doctor. It could also occur because when the light is being used to cure, and if the light wasn't charged completely, there's partial curing and some portion is not cured and air gets trapped in between. When that happens, the patient usually complains of shooting pain when they bite on food. Uh,
On
that's
chewing?
the only time, yeah, on chewing. Sometimes the fillings are extremely large, they involve more than two walls of the tooth structure. Believe me, it is a challenge for any doctor to do that filling right. Make
Yes.
sure. Sometimes patients have an erroneous bite. They have, they tend to put more pressure than
No
required,
pressure.
especially on the tooth. That is,
Yes.
patient has paranormal habits. They tend to
Yes.
grind their teeth at
Right.
night. So I put in a filling in the evening, and they go back, and the whole night they've ground on it, and
Ground.
tomorrow morning the filling
One.
broke. You can't really blame the dentist for that. Though these days we ask and we tell patients that if they have paranormal habits, then precautions have to be taken. We are human. Intentionally, I don't think anybody would, because it's again double work for us. If I have to go back
Yes.
and redo the filling
Yes.
again, uh, it's in no way beneficial to me. So I
Right.
don't think anybody would do it intentionally, but these things can happen.
Yes, and also considering when there's a filling that happens between two teeth, and especially if the decay is so deep, it is kind of gone, under the level of the gums, what we call as root
Oh yeah,
caries. I think such
it's the
times,
right filling.
as fillings become a real challenge. I think it's a bigger challenge than doing an RCT or an impaction, like a surgical removal of a tooth, because I think patients keep kind of coming back. That I have this weird feeling that something is stuck between my tooth, something is stuck between my tooth. That kind of.
I think that is also mismatched expectations. I think a lot of doctors tend to give them too much, in terms of what they can expect.
They can
I
deliver.
have to be realistic. So I tell my patients, hey, look, this is an artificial. Your own original tooth couldn't survive in your mouth. Right? I'm no god. I mean, I can only replicate or come as close as possible to nature. So I'm not going to claim that I'm better than what your original was. I think it's very important to be honest with the doctor and with the patient and tell them, hey, look, this is a filling. It's an artificial material. It's been stuck. Okay. So the weakest point is the point where the filling and the
Right.
tooth are meeting.
Yes.
Right? Like anything that you is broken and you fix it back, there's always a chance of it breaking,
Yes.
right? So it's important to be realistic. Sometimes I tell them, we're trying a filling. If it stays, good for you. If it
Yes.
doesn't, you're going to have to come back. We have to look at alternate options. So
Yes.
it's very important to lay it out bare in front of the
Yes.
patient and let them know what they're in for. I think most of the time it's the mismatched expectations that.
Yes, I think the communication that happens, where
Yeah.
the what the dentist says that it is possible to do, and what the patient understands is actually possible to be done in his mouth. And also considering the fact that a patient who has a high caries index, which means patient who tend to have more decay in their mouth, the chances of secondary decay, what we call, probably like you said, the joint between the tooth and the filling is the weakest point. So a decay again happening in this point is very high in these patients.
Absolutely. Sometimes your salivary pH is different.
Yes.
They are on drugs for different reasons. So there are a whole lot of factors at play, and it's not as simple as me going in and. A lot of times it is simple, but a lot of times it can be complicated. So if we have to take it case by case or tooth by tooth is what I tell my
Yes.
patients. Yeah.
Yes. Yes. Okay. So the next question would be: can a dentist heal a tooth cavity?
Uh, it's a bacterial infection. We can try our best to clean up the tooth till we get a healthy layer of tooth. But these bacteria are microscopic. So I'm not really looking at them through my natural eyes. So I'm not sure if I have eliminated the last bacteria. However, there are ways and means of ensuring that we remove the smear layer, we remove the entire bacterial layer. There are also ways and means of putting like a dye to check and see if
Yes.
we've left behind any. So
Yes.
we can foolproof it to a large extent, but am I 100% sure that I've healed the tooth? 9 out of 10 times, yes. I'm pretty sure. But there could be times when there's
Yes.
secondary decay. That, like I said, there are other
Yes.
factors. If the
Yes.
patient has a high caries index, if the salivary pH is different, if the patient is not maintaining their hygiene,
Maintaining it. Yes. Yes.
then there's very little that I can do.
Yes. Yes. So, at what age should the tooth be filled?
As soon as the tooth erupts or as soon as the first cavity is visible. The minute you see a cavity, a lot of times it is reversible. In the initial stages when it's just demineralization, we in fact tell the patient, if you notice every day morning you're brushing your teeth, one quick glance at all the biting surfaces. If you notice something is amiss, come immediately. A lot of times at that stage, I don't need to drill and give you a filling. The next stage is when the grooves are starting to discolor. We can give them what are called pit and fissure sealants. What these do is it's like a liquid. You
Yes.
just fill the pores. If there even a tiny opening through which bacteria can go in, the pit and fissure sealant will seal those gaps. Again, it is preventive. We're not drilling too much. Stage 3 is when the cavity has actually gone into the tooth structure, but it is localized to one area. Then we
Yes.
can clean it up, give a filling, prevent or arrest the caries at that point. So, earlier you see the doctor, less traumatic the procedure is, less invasive it is, less amount of drilling that is required. It all depends on how soon you're able to go and see your dentist.
Dentist. Yes. So that's the reason I think why we insist and say, come for a checkup once in 4 months at least, so that anything
Yes.
can be detected. Because also because of the diet habits and, the oral hygiene maintenance habits that the patients have is very variable. So even the same patient probably can't do everything like, like a regime. So some days, it does, there is some amount of lapse that does happen. So I think a regular checkup, the dentist will be able to detect some things, at the earlier stages itself.
Dr. Rekha, the lockdown period is going to see a lot of this. A, because sleep schedules have gone for a toss. You and I are testimony to it.
Yes.
Uh, Dietary habits. We are
Yes.
eating, we're more sedentary, we're eating more
Yes.
sugar based stuff. Because we are staying up late, we're going to munch. So
Yes.
there's a whole schedule that is gone for a toss. I won't be surprised if people
Come back with
come back with, yes. So I would tell people it's not something you should worry about, but please don't wait for it to become a big issue and come
yes.
back with pain and trouble. And come
Yes.
at the early stage. We do something very simple, and you and I both are happy.
I know. Okay. So, can I heal a cavity without going to a dentist? I think a lot of
I wish.
patients try to do this.
I know. A lot of patients who tell me they got an Ayurvedic powder that they mixed, and
Yes.
I have full respect for the alternate medicine, but all of us have our limits.
Yes.
I don't think there is any natural way of healing a cavity on your own. That's impossible.
Yes.
I can go ahead and safely say it is impossible.
Yes.
Like I said, early caries, demineralization at the stage 1 is reversible provided we do localized intensive fluoride applications in terms of chair side as well as high fluoride paste for a short period of time. But that has to be done with a dentist monitoring it because there are side effects of doing excess of fluoride. So this is not something I want to take lightly or say it lightly on a program like this. So everybody says, hey, okay, let's all go take a fluoride toothpaste. And it doesn't work that way. You have to go by the area in which the patient lives, the level of fluoride
Yes.
in their groundwater, how old the patient is. The older you are, lesser the chances that the paste is going to work. So there are multiple factors. So please, like I say, statutory warning, do not try this at home without
Yes.
the
Without
guidance of the
guidance.
dentist. Please.
Yeah. Okay. So can vitamins heal tooth cavities?
I wish. No, I don't think any vitamin can heal a tooth. It's just not possible. It's in no way. Of course, your general health could improve because of the vitamins, but a decay. People ask me, doc, so if I drink milk and increase my calcium intake, is my decay good? I wish it was that simple. So I want people to understand dental caries is a multifactorial disease. So there is no one thing that can cause it or one thing that can prevent it.
Cure it.
So it's a combination of factors. Now, there are a lot of people that I feel really bad for because they maintain excellent hygiene, but they have a very high caries index. I want to tell those people, it's not your fault. There is a gene in you which you received
Yes.
as a gift or by
Yes.
default from your family, from your parents,
Yes.
which makes you highly prone to caries. So I know how these patients beat themselves up. They're like, doc, I did everything you told me. I used an oral irrigator and I did this and that, and yet they come back every few months with a new caries. I see them regularly. My heart goes out to them, but I also tell them, hey, don't be so harsh on yourself. It's not your fault.
Your fault. Yes.
It's categorically it's not your fault. So I'm sure there are a lot of people, if they are listening, and would say, hey, that's me. Yeah, not your fault, but you're going to have to make your dentist a good friend. You're going to have to meet them regularly and
More often.
have a relationship.
Yes, yes, yes. But having said that, I think in spite of that being, well, if we can say inherited to an extent, but I still routine oral hygiene practices is a must. You can't give up on that. Still, the rest of the
Absolutely.
probably 60-70% of the population, still,
They have to be even more prudent with it.
yes,
They may
yes,
have to be that much more tight with their
yes,
schedule.
yes,
But they have to visit their dentist frequently.
yes. Okay. So my last question. A silver filling versus a tooth colored filling. Which do you think is better? This is probably, I think, one of the most.
Overwhelmingly, the composite or the white color fillings have taken over the market. And there's a good reason for that. I have used silver very early in my practice, not when in the private practice, but when we were studying. It's got a lot of good things about it. Okay, it was a very economical, a very long-lasting filling
Yes.
for almost a century. But it also comes with its drawbacks. So when you weigh the good versus the bad, I think I would stick with composite fillings going forward. But yes, there are situations, sometimes it's rural camps, we're doing large scale cavity preparations and budget is an issue. Then silver fillings are an amazing option. And I mean, I wouldn't discard them.
Yeah. I mean,
Still
if,
have a soft spot for them.
yeah, I mean, if patient is okay with a black colored filling in the mouth, I think a silver filling still is a good material of choice.
See, there's a lot of study about nickel and its side effects, and I'm saying even if there is an iota of doubt, 'cause we live in very difficult times, Dr. Rekha. There's so many other forms of chemicals that are being ingested into the body. I just don't want to be a contributor to it. I may not be directly causing it. My feeling may not directly be causing it, but even if it is contributing to 1% of the well-being of my patient, then I say, why? I mean, why not stick to a safer alternative? That's my way of looking at it. I mean, there are people who could argue on the opposite side. Like I said, silver is not a bad filling, but I'm
Yes.
saying when there's something better available,
Yes.
safer available, why not go for composite? It's good.
Yeah, I think in terms of strength and all that, these newer composites, are on par. They have good strength
Yes.
in terms of, lasting in the mouth in that sense.
Oh yeah,
As a
with
material.
nanotechnology, uh, I think we've got it right.
Yes.
We've kind of arrived at the exact filler size that we
Yes.
want, the kind of finish we want for the
Yes.
posterior. That balance between strength
Yes.
and finishing, aesthetics
Yes.
and function.
Yes.
I think some companies have done a fabulous
Then,
job.
yes.
I find it very exciting to use those products, because the
Yes.
kind of things you can do with them, phenomenal, phenomenal.
Yeah. Yeah. So, Dr. Ranjani, thank you so much. That was very useful information on, I think, probably some of the very basic doubts our patients could have about a tooth filling. Because again, tooth filling being such a, for us, it's like one of the basic treatment procedures that we would do in dentistry.
Yeah, well, very, very happy to clear whatever doubts people have. Uh, like I said, I hope people come for a regular checkup, get rid of those cavities at the initial stages, don't allow it to become a big issue. Then you're looking at root canals and crowns and multiple visits and pain and injections and all of that. So visit your nearest dentist. It is safe. We dentists are doing, taking a lot of precautions to, make it safe for you all to
Yes,
visit us.
yes,
Uh,
yes.
See you at the clinics.
Yeah. Okay, so thank you so much, Dr. Ranjani. I hope I can get you back for another topic on oral and dental health that you can share with our patients.
Thank you so much. It's always a pleasure.
Thank you. So, viewers, that was Dr. Ranjani Rao, who did tell us some basic doubts that you could have about a tooth filling. If you have any doubts or queries, please do write to us in the comment section below and we will get back to you on that. For more information about your oral and dental health, do visit our website www.thedentaire.com. Subscribe to our YouTube channel and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. So until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling, stay safe, and be happy. Thank you.